Thank you very much, Jean-Luc. Actually, I'm very proud of this partnership. It's very important for us to partner with Mauritius Media Trust Board to provide this type of health media training, which is, I think, very unique because it helps the community as partners to be the voice of the voiceless, break the silence about very sensitive and critical issues, such as infertility stigma, as you know, support girls' education, ending child marriage, ending gender-based violence, raising awareness about diabetes and hypertension, many other topics that it can be very sensitive but very critical to our communities, that it's a stigma or a taboo to talk about. It's very important that the media grab hands on it and start to sensitize the communities and normalize it. We have provided this training to 35 countries. More than 2,500 media representatives benefited from this training, which we find very valuable because after this, the stories and the work they provide, it's very important, very informative, and very bold, which is very, very important. Of course, we after that, as you know, we called for application for very important awards, media recognition award for all Africa, and we would like the Mauritian media to representative to also participate and apply for these awards because I'm sure they're gonna win.
Give us an overview of the collaboration with the Mauritian authorities because there's a lot of training for Mauritian doctors. In which field exactly?
This is also another initiative and program that we are very proud of. In partnership with the Ministry of Health and Wellness, we have provided scholarships to more than 73 doctors from Mauritius in 32 critical and underserved specialty. Of course, as we all know, oncology is very important, infertility specialty and embryology, of course also sexual and reproductive care, diabetes is very important, cardiovascular and cardiovascular preventive, which is very mainly about hypertension, respiratory care, acute care, we have also pediatric emergency, we have emergency and resuscitation, there's many specialties that ophthalmology, advanced surgery, laparoscopy, neuroimaging and science is very, very important specialties that I can't also mention all of them now, but I think will be a very important milestone to improve patient care landscape in Mauritius nationwide in the public sector.
What are the feedbacks about what's going on in the health sector with the training provided by Merck Foundation?
Actually, they are very happy about this training. We had the testimonies and they shared their experience and how they saved many lives and the quality of patient care so much improved after the graduation and after taking this training, because as you know, the training is 1-year diploma and 2-year master degree in a very well recognized universities like South Wales University, Queen's University, Cardiff University, and there's a clinical training in a very important training institution in India like Tata Memorial Hospital and Milan University. Milan University in India. So there is a lot of important training partners and institutions that we are partnering with, and the scholarships is provided there. So everyone who graduated from the scholarships, they are really raving about it, and they see that there is a really important impact they added to their community, their practice, and their patients.
This year in the luminary in India, Mauritian doctors saying that in pediatric sector they need more training. Are you going this next year to provide more training in pediatric sector?
I am actually, like you said, we are partnering with the Ministry of Health and Wellness, and wherever they're gonna request, we will search where we can find the proper training that it can be provided within our partner network. And if we find it, of course, we are doing it. We have now the pediatric emergency. and neonatal care. So these both are the two courses that we have with for pediatric and also pediatric oncology, which I actually was speaking to the Ministry of Health yesterday, and they said that they need pediatric oncology, and we have these courses available. As soon as we receive the names of the doctors and the request from the Ministry of Health formalized, we are going to provide it, definitely. And more importantly, they are very serious about it. They have the highest grades. They are very clever.
They're good students.
Yes, very good students. And the quality of their practice and their, the exams and all this, very high. So I'm very proud of this. It's More Than a Mother is a very important signature campaign for Merck Foundation because it helps us break the stigma of infertility and also empowering infertile women through access to information and health and change of mindset. These three things is very, very important. Information, not every woman was knowing that she can be the cause of infertility or not, or infertility can be prevented or not, or her husband can be infertile or not. All this information needed to be delivered to the women to know their rights and to stand up for themselves and not accept any violence or discrimination due to, the delay of having a child. And every man needs to know that he can also be infertile and he can go to the doctor he must go to the doctor with his wife, because her going only to the doctor by herself will not add any value, because both of them responsible. It's a shared responsibility, and the community knows that they don't bother the infertile couple or don't keep asking them when you have a child or not. The mother-in-law should not annoy the wife and
I was going to put you the question
her.
because in Mauritius it's still a taboo. How can we overcome this kind of, because things have been changing in some African countries where Merck Foundation, Merck More Than a Mother, has started this program, this campaign?
You can change that. You, Jean-Luc. As a media person, you should be able to talk about this all the time in your TV or in the media outlets or the TVs and the radio and the newspapers. And people, when they start to read about it every day, it will be normalized. It will be like normal, like diabetes, hypertension, any other condition. It will not be a taboo or a stigma, because we keep saying
in Africa.
Yes, it's changing in Africa. Now, if you search infertility Africa, when I started in 2012, when I searched infertility Africa, I found only one article, and it's all blaming the women. He should marry another wife. He should divorce her. But now the whole story is different. People are now recognizing that men goes to the doctor, women goes to the doctor with their husbands, and they don't accept a no from the husband. I'm not going with you, or you are the reason because you are the one who get pregnant, not me. I am sexually able, so I'm not infertile. This is a big difference between sexuality and infertility, and we always highlight that through our training with the media, and we ask the media to highlight this in their work.
Yeah,
so it's amazing.
It's amazing how
yes.
you've been able to embark all the first ladies from
yes.
Africa in this project. What are they? Why do you think they are really eager to participate in this campaign?
First of all, they are women. Before they are first ladies, they are African women. They know the needs of their countries. The incidence of infertility is so high. It's not like a small number of people who isolated. No, it's one couple every 4 couples are infertile. So it's like 25% of the people in the reproductive age, the youth. 25% of the youth. So it's a very important issue that it is considering like a scar in the social fabric, because it's a psychological and emotional, and it creates a stigma and taboo and a scar in the people who, emotional scar. So it's very important to address that. And who can do it more than the First Lady, who has the biggest platform? She has the social media, she has the platforms that she gather with the people, and she can actually advocate for it. And also she can collect the funds and resources to build something for them, like either IVF center or a place to empower them economically, and for women who cannot have children anymore, so they can be independent and powerful.
Over and above health sector, you're engaging Mauritian artists, Mauritian fashion designers in your programs. You have a deep love for Mauritius, right?
Yes, I love very much. I love Mauritius, and I love Mauritian people. I have a lot of friends, and you are one of them. And we dealt with media, with fashion designers, with artists. They are very talented, very talented. I think the weather and the beautiful weather and the island inspiring. Yes, definitely, because when I come here I also get inspired very much with new ideas. So I envy you because you're living here all the time. So we deal with them, and you know that in our Africa TV show, which I created for Africa's 15 episodes to raise awareness through fashion and art with purpose, and we invited a lot of fashion designers from Mauritius, and it was really lovely. They have a really important messages that it's being created on the designs. And we had also the song, which you love very much, No More Diabetes in French. What is called in French? Yeah, with Laura. And it's a very nice song. We had it in English, French, and Portuguese, and we have also the remix.